This video is on multiple myeloma. I'll talk about what it is and how it relates to leukemia. We'll be putting multiple myeloma onto the same classification chart as I introduced in my video Leukemia and Lymphoma. I'd recommend watching that video first. Multiple myeloma is a type of cancer that develops in the bone marrow. Leukemias also develop in the bone marrow, while lymphomas almost always do not. Let's draw that part of the chart and put multiple myeloma as a cancer that develops in the bone marrow. We'll add more to this chart in just a minute. First, a bit more on multiple myeloma itself. It's unique in that it's the only cancer type to develop from plasma cells. Plasma cells normally produce antibodies to combat infection, and plasma cells themselves develop from B cells in response to infection. B cells are a type of lymphocyte in lymph nodes and other lymphatic tissue. B cells develop from lymphoid stem cells in the bone marrow before they move to lymphatic tissue. Thus, multiple myeloma is similar to lymphoid leukemias in that it develops from a lymphoid cell. Let's add that to our chart. Multiple myeloma can thus arise when there is a mutation in a lymphoid stem cell that causes that cell to mature all the way to being plasma cells without ever leaving the bone marrow and without needing an infection to fight. The cancerous plasma cells in multiple myeloma are thus mature. In the world of leukemia, cancers in which the cancerous cells can mature are called chronic. Those in which the cancerous cells can't mature are called acute. Multiple myeloma, since it involves cells that mature, is thus similar to chronic leukemias. However, multiple myeloma is a different entity. It's not actually considered a type of leukemia. The reason why multiple myeloma is in a category of its own is that, unlike the cancerous cells in leukemias, cancerous plasma cells are much more trapped inside of the bone marrow. Almost all cancer cells in multiple myeloma stay inside the bone marrow, so the cancer cells can almost never be detected in the blood. In contrast, in leukemia, enough cancer cells usually escape into the blood to be detected in the blood. The cancerous plasma cells in multiple myeloma may be particularly well trapped in the bone marrow because cells don't usually mature into plasma cells until they're already outside of the bone marrow. Thus, plasma cells haven't needed to develop a way of getting out. Symptoms of multiple myeloma are thus related to cancer cells taking up space inside the bone marrow and preventing the production of normal blood cells. These symptoms include anemia, susceptibility to infection, bleeding, and bruising. However, multiple myeloma is distinct in that the cancerous plasma cells tend to eat into the bone around them, causing bones to break more easily. Eating away at bone also releases into blood the chemicals the bone was made of, including calcium. Increased calcium in the blood can cause additional symptoms. Multiple myeloma is also unique in that it produces antibodies. I've mentioned plasma cells normally make antibodies, which are proteins that stick specifically to parts of invading organisms. Cancerous plasma cells still make antibodies. In fact, they can make very large amounts of a single type of antibody. These antibodies, called IgM or IgG, can be detected by a lab test called serum protein electrophoresis and can get stuck in your kidneys. Since kidneys remove waste from the blood and allow that waste to be excreted as part of urine, kidney problems can affect urine production and the removal of waste from the body. Most other blood cancers do not produce antibodies, so don't have these complications. Hopefully this has helped multiple myeloma to make a bit more sense. I also have a video on myeloproliferative disorders and myelodysplastic syndromes if you're interested in how those relate to leukemia.